Thank you much, Mr. Chairman. Innovation. It appears there's more innovation among lawyers dealing with patents than medical researchers. I cannot believe that what we started off with in the Constitution, with a patent right, for obvious reasons, has now been so convoluted and distorted that we've reached the point we've reached today.
Yeah, you bet.
And I listened to some of the suggestions here. I think we are dangerously close to building a bipartisan consensus about change. It rarely happens around here. But it may just happen in this circumstance. Mr. Stansel, you have the unenviable task here of dissenting from most of the views that have been expressed. But let's address for a moment direct-to-consumer advertising. How many countries in the world allow pharmaceutical companies to put ads on television and in the media?
I believe there are two.
Do you know the other one?
New Zealand, I think.
New Zealand and the United States of America. And do you have any idea how much is spent by Pharma on television advertising?
I don't have that figure, no.
$6 billion a year. The average American sees 9 ads each and every day. Do you have any idea what the most heavily advertised drug is on television?
I don't know.
It's Humira. And we've talked about it today and their efforts to maintain their patent or exclusivity rights. Originally designed to address forms of arthritis like psoriatic arthritis, they've now ventured into some expanded uses of Humira. One of the uses involves an ad you've probably seen of a lovely young lady sitting by a swimming pool in her swimsuit with milky white skin, saying that because of Humira, she no longer has to deal with the red patch on her elbow from psoriasis. It turns out it works on psoriasis. Do you have any idea what Humira cost a month?
I don't, no.
Well, let me show you. It's $5,500 a month for that little red patch on your elbow. And I guess the thing that troubles me is one of the things you just mentioned here. I listen to these ads, you can't escape them, and in 60 seconds, it's just a barrage of information about contraindications and things to be concerned about with Humira and other drugs. I love the one that says it may kill you. The other one that says don't take Humira if you're allergic to Humira. That's an interesting challenge to the consumer. But in all the information that is put out by this drug company based in my state about Humira, the one thing lacking is what you just saw, the price of the product. And I have to tell you, I don't think your answer was very good when we suggested that the consumer should know. You directed the consumer to a website in 60 seconds, you couldn't flash, that company couldn't flash on the screen the cost of the drug? Is that what you're saying?
Well, first of all, let me say that a lot of the things that you talked about are actually required by the FDA. So telling somebody that they might die, whatever those side effects are, that's actually explicitly required by the FDA, which has the responsibility to oversee drug.
And I think they should require pricing too. Why is that important? Well, Blue Cross Blue Shield in Illinois tells us that the largest single driver in an increase of health insurance premiums is the cost of prescription drugs. They spend more each year on the cost of prescription drugs than inpatient hospital care. Think about that for a second. All the surgeries and all the hospitalizations, more on these prescription drugs. And I look at some of these, like insulin, for example. 98 years ago, insulin was discovered by some researchers up in Toronto. They surrendered the patent rights to that, saying we don't think anybody should profit off a life and death drug. And they surrendered the patent rights for $1. And where are we today when it comes to insulin? Do you have any idea what's happened to the cost of insulin, Mr. Stansel?
You know, insulin is actually an interesting example of how incremental innovation works, because the product that originally came on the market 98 years ago was essentially ground up animal intestines. And the product that's on the market today, there are multiple products. They are recombinant products. They're made to be long-acting so that individuals don't have to necessarily inject 6 or 8 times a day.
So let's take a look at one of those new products on insulin. Let's take a look at Humalog, which is made by Eli Lilly, based out of Indianapolis. Humalog in the 1990s was selling for about $39 a dose. It is now selling for $329 a dose. And I can tell you, having met with some people in Illinois whose kids are facing diabetes, it is a burden which many of them just can't handle anymore. It's gone up dramatically, way beyond the grinding up of intestines. That modern form of Humalog has gone up so fast in cost. Do you know what it cost in Canada for exactly the same drug made by the same company?
I do not.
$39. So the Canadian government cares enough for the we have 7 million diabetics in America. I don't know what their number is. They care enough to make sure that Eli Lilly doesn't kite the cost on that. Mr. Mitchell, one of the drugs that Revlimid that you've taken in the past has faced multiple patent reinventions, has it not?
It has, and they do things like they patent the method of administration. One of the drugs they use in combination with Revlimid frequently is a generic drug, cheap, called dexamethasone. But somehow, even though it was being used in practice that way for years, Celgene managed to get a patent on that method of use. But there are many other patents around it, and Celgene has refused to provide samples.
I've run out of time. I wish I could have talked about the size of the vials that are sold to the government of cancer drugs. We pay for hundreds of millions of dollars each year for drugs to be thrown away because the drug companies refuse to sell it in anything other than a vial large enough to take care of a Chicago linebacker who might be facing cancer. And so we throw the rest away at expense to the taxpayers and to the patients.
I take one of those, Senator.
Velcade.
And the Velcade. And the vial size is 3.5 milligrams. The dose for me is 2.1 milligrams. The rest goes in the trash. It doesn't have to be that way.
At your expense and at the expense of the federal
At the expense of me and the federal government.
Thank you.